All right, so we are in week 6. We are finishing up skeletal system and starting muscular system this week. All right, so next week you have exam 2 over chapters 4 through 6. That's skin and body membrane, skeletal system, and muscular system. All right. So let's pick up where we left off at the appendicular skeleton. All right, so we have our pelvic girdle. So you have a pectoral girdle, which is basically like your scapula and your clavicle. Now your pelvic girdle is your coxal bones, so your ilium, ischium, and pubis, which are essentially fused together. And you have 2 of those, or 2 of each. So you have 2 coxal bones, and they have basically a piece of cartilage in between called the pubic symphysis. Okay. You'll see there's another structure that you'll need to know on the surface of the pubis called the obturator foramen. Now, there are differences in the pelvic girdle depending on if you're male or female. Females' hips are going to be broader, right? Because females have the ability to bear children, males don't. All right. So female pelvis is going to be wider. The inlet and outlet of your what we call the true pelvis is also wider. Pelvic cavity is more shallow. The bones in the pelvic girdle are lighter and thinner. And the pubic arch in females is wider as well. Okay. So here are some different structures that you do need to know. Again, we'll start here in the superior portion. You have the ilium, okay, with this iliac spine across the top. This is your ischium, and then your pubis. Okay. So in the ilium, right, ischium is sort of toward the back here, and the pubis. Okay. This little forms like a triangle is the pubic arch. The space in between the pubic bones is the pubic symphysis. Okay. All right, and so this shows you differences again between male and female. Okay. Pubic arch in males is narrower. So this is the sacrum, and the space in between the sacrum and the ilium is the sacroiliac joint. You have one on either side. All right, this little hole where the head of your femur is going to connect or articulate with the os coxae, pelvic bone. It's called the acetabulum. You can see it here. This is the acetabulum. You can also see it in here. So it's really this specific little area inside there is the acetabulum. This hole that you get down here, kind of in between the ischium and the pubis, that's your obturator foramen. Okay. All right, so lower limb. Start with the femur. So it's the longest bone and the strongest bone in your body. And as we mentioned, the head of the femur fits into the acetabulum of the coxal bone. You have structures called greater and lesser trochanters in your femur. And those will attach muscles of the thigh and the buttocks. So they're attachment sites for muscles. You have a line that runs down your femur called the linea aspera, and it's an attachment site for many muscles. So the linea aspera, all right? You also have structures called medial and lateral epicondyles, which are also attachment points for muscles and ligaments. You also have lateral medial condyles, and they form a connection point with your tibia, which we'll talk about in a moment. Then you have what we call a patellar surface, and as the name suggests, it articulates with the patella. All right, so here's a picture of the femur. Okay, so this is the head of the femur. Okay, there's your greater trochanter, your lesser trochanter, so those basically knobs on the femur near the head. The neck basically connects the head to the shaft of the bone. All right, so toward the distal end, you'll see the epicondyles and then the condyles. Okay, condyles are more distal. This is your patellar surface. So the patella will articulate with the femur here. Okay, but these are medial because they're closer to the midline. And on the sides, you have lateral. Oh, and this is anterior. Just want to make sure so you're looking at this from the front. This is posterior, looking at the femur from the back of the body. All right, so tibia and fibula. So those articulate with the femur. So the tibia is more medial, okay, toward the midline. That should make sense because it's having to support the weight of the body. Bears weight from the femur. Now it has condyles at the proximal end, and they articulate with the femur, with those condyles on the femur. You have a ridge here, a bump called tibial tuberosity. Patellar ligaments attached there. Okay, running along the front of the bone, or the anterior surface, is the anterior crest. Now you also have this little knob down here on the distal end. It's called a medial malleolus. And it articulates or communicates or connects to the talus bone in the foot. And articulates is a fancy word. Like when you say you articulate something, you're talking about communicating, right? So bones articulate by touching each other, okay? So that's what we mean when we say articulations. Okay. The fibula is lateral to the tibia, so it's away from the midline. Helps to stabilize your ankle. All right, let's get to the foot. So there's 7 tarsal bones. Remember, carpal is wrist, tarsal is ankle. So you have 7 bones in your ankle. But only the talus moves freely. And here's the talus. And the talus and the calcaneus support the body's weight. So these 2 bones here, these larger bones. Now you have 5 metatarsal bones right here. Okay, and these are they form what we call the instep. Okay, kind of part of the arch of your foot. The phalanges form your big toes. So just like your hand, your big toe has two phalanges, proximal and distal. And the other phalanges have proximal, middle, and distal phalanx. All right, and just to be clear, I mean, the way they drew these lines, these are the metatarsal bones, okay? These are the tarsal bones. So 1, 2, 3, 4, 5, 6, 7, okay? All right, so before we go on to articulations and joints, I want you to take a minute, talk with your partner about what you learned about the pelvic, or basically the lower leg, right? It's the bones in the appendicular skeleton. Okay, so we learned a little bit about this in lab this week as well, so it's some overlap. So how do you classify joints or articulations? Are you going to classify them based on structure, or you can classify them based on function or amount of movement? So if we go by movement, you have synarthroses, amphiarthroses, and diarthroses. A synarthrosis is immovable. A diarthrosis is freely movable. An amphiarthrosis is somewhere in the middle. Okay. Now, if we classify joints according to their structure, they can be fibrous, cartilaginous, or synovial. Okay. So it just depends on how we want to classify them or describe them. All right, so the fibrous joints made up of fibrous connective tissue. And if it's fibrous connective tissue, one of its main roles is to connect bone to bone. Again, typically doesn't move. So again, these sutures in the cranium, okay, your sutural bones, right? They have sutures in between. These typically are immovable, all right? When a person is a fetus, you want them to be movable so the fetus can get out of the birth canal. But once that's over with, you need a way for those bones to then fuse together. So you have the coronal suture, right? And it's between the parietal bones and the frontal bone. So kind of across the top of your head. Lambdoidal sutures between the parietal bones and the occipital bone. Squamosal sutures essentially between the parietal bones and the temporal bones. And you have sagittal sutures between the parietal bones, okay? And the joints essentially get formed by pieces of the bone kind of attaching, or teeth sort of connecting into different sockets. All right, so show you a view of some of these sutures. All right, so here's your view suture, frontal suture or coronal suture, parietal and frontal, a squamosal suture between the temporal bone, parietal bone. Okay. You have occipital suture, or your lambdoidal suture here between your parietal bone and your occipital bone. Okay, for the cartilaginous joints, these are made up or join the bones by hyaline cartilage or fibrocartilage. and they usually have some movement to them. In the synovial joints, the bones aren't actually touching typically. Okay? You want there to be some space, some cushion. And that cushion is the joint cavity, synovial membrane, synovial joint cavity. And these usually are very, very movable. Okay. All right, so here's an example of a synovial joint. Here at the knee joint. So here's your joint cavity, okay, lined by synovial membrane. Here's articular cartilage on the surface of the bone, okay, prevent the bones from touching, but you also have synovial fluid in here. Okay. You also, from a lateral view, you can also see there's some adipose cells, adipose tissue also provides some padding. All right. Different kinds of synovial joints out there. You have saddle joints, ball and socket joints, pivot joints, hinge joints, gliding joints, and condyloid joints. Okay, and this is under the synovial category. Okay, and we'll spend some time on these. All right, let's start with the ball and socket joint. Probably one most of you are familiar with. It's called that because the head of some bone fits into a socket. All right, like the scapula and the humerus. It's like a ball going in a socket. Okay, you have lots of large range of motion, right? Now your elbow joint, your knee joint, these are considered pivot joints. Okay. So essentially you really just have one plane of motion, right? You're pivoting along that joint axis. Now, and I want to clarify here, so this is like your radius and your ulna. So this is just pivoting or sliding. So if I'm pivoting, think about like in sports. So a person, if they pivot, right, they're turning, like if they're gonna box out somebody in basketball or something like that. So they're pivoting. So in this case, pivoting is really, if I take my radius and my ulna, and I'm pivoting around this joint. So that's the pivot. So I just want to make sure everybody understands that's the pivot. Now, if I move my arm up and down like this, that's a hinge, okay? It's like a hinge on a door, right? So that's the hinge joint. So I want to make sure everybody understands the difference. Okay, the gliding joints here in the bones of the wrist. All right, and to a certain extent, they can glide along each other to allow for some movement. Now the condyloid joints, joints of your second through fifth phalanx or phalanges, between your metacarpal and your phalanges. All right, so right between like the base of your hand and your fingers. Okay, you have condyloid joints. So you have a bit of kind of range of motion, right? You can. So we're not talking about your knuckles or your knuckles and your fingers. We're talking about the base of your hand where it meets your fingers. So you can kind of move your fingers just a little bit at those joints. Now on your thumb, where your metacarpal bone meets your phalanx and your thumb, that's actually called a saddle joint, okay? So saddle joint for the thumb, we'll call that because this looks kind of like a saddle if you're being creative. The other fingers, you have condyloid joints. Okay. Now we can categorize the movements of these synovial joints. So you have angular movements, circular movements, okay, and special movements. So angular, which means you're moving along a certain angle, right? One plane of motion. If you're circular, you're moving in a circular motion. And these other movements that don't really fit in those categories are special, okay? We'll go into these. All right, anytime you decrease the angle, that's called flexion. Anytime you increase the angle, that's extension. So you see here, this person is flexing their leg. So they're decreasing the angle. This person is extending their leg now. They're increasing the angle. If you move an arm or a leg away from the midline, that is abduction. You move an arm or a leg back to the midline, that's adduction. Now for circular movements, so if you, essentially it's your elbow joint, you get a bit of rotation, not much, you get some. Now, at your hand, this is normal anatomical position, palms out, okay? Thumbs out. Thumbs in, it's called pronation. Thumbs back out, supination. So pronation, supination, pronation, supination. Now with your ankles, essentially if you move your ankle in so that the sole of your foot's facing the middle of your body, that's inversion. And if you move your ankle out so that the sole of your foot's facing away from the midline of your body, that's considered eversion. All right, so let's practice a little bit. So all right, take your arm, put the arm out. Okay, all right, so let's flex our arms. Let's extend our arms, okay? All right, let's adduct our arms. Let's abduct our arms, okay? All right. Put your palms out. Okay, it's pronate, supinate, pronate, supinate. Okay. Now you have to do this one just at your table. You know, I won't be able to see you, but you know, move your foot so that or move your ankle so that your sole of your foot's facing out or facing away from the midline of your body. You're inverting. Move your ankle so that, sorry, I got that backwards. So if you're moving your ankle so that your foot, the sole of your foot's facing toward the midline of your body, you're inverting. If you move your ankle so the sole of your foot's facing away from the midline of your body, that's everting. Eversion. All right. So how does aging impact the skeletal system? So as the person gets older, cartilage and bones start deteriorating. Your articular cartilage doesn't work as well. You can get arthritis. You have a few different kinds. You have osteoarthritis. That happens when the articular cartilage itself starts deteriorating. Now, if it's rheumatoid arthritis, you actually get some inflammation in the synovial membrane. Another condition sometimes you can see is gout. And gout just means you have excessive buildup of uric acid. Okay. And it can make those joints extremely painful because you've got acid crystals built up in your joints. Also, osteoporosis is very common, and that just basically means you have porous bones that, start to have holes in them. Okay, they become weaker. All right, homeostasis. So this is what the skeletal system does normally. Protects your organs. All right, helps you with respiration, actually. Helps you store calcium and release it when your body needs it. It assists your lymphatic system, helps you with immunity, right? Because it's making your blood cells. Helps with digestion. And you need it to move, right? Attachment sites for your muscles. Now, if something goes wrong here, you're disrupting homeostasis. So what about other systems? Do they have any impact on the skeletal system? Well, the integumentary system also helps to protect internal organs. The muscles do as well. All right, so your digestive system absorbs calcium from the food you eat, right? And then your bones are able to absorb some of that calcium. The endocrine system also impacts how well your bones are able to store it, okay, through hormones. Okay. Muscular system relies on the skeletal system, okay, because you have to have an attachment site for those muscles. Muscles can't contract otherwise. Okay, so I'm going to give you all a minute to talk about the different articulations and body movements